Thank you, Gong, for your most kind remarks. And I'm so honored by the presence of everyone here, especially Mr. Steve Smith and your family for this celebration. So it's quite amazing how life has guided me to a journey to this point here. If I didn't transfer to Penn State 7 years ago to reunion with my wife, if I insisted to join an immunology lab, but didn't open my mind to neuroscience 7 years ago, if I choose to join another rotation lab instead of Yu-Chen Chen lab, if I didn't start with NeuroD1 project and then stick with the stroke work, no matter what obstacles we had encountered, if all this didn't happen, it could be a totally different journey, and I don't know whether that would be a better past 7 years. So upon reflection, working on this manuscript has been a journey full of ups and downs. And I think anyone who has survived the PhD or who's working towards it would agree that any project is filled with struggles and challenges, as well as some fun and excitement, but unfortunately, in many cases, there are much more times of the former ones than the latter ones. To give you some examples, this whole stroke project has been started with the struggle from the very beginning when I tried to create a large local stroke injury in the mouse brain. It took me almost 9 months to find the best combination of the chemical and the mouse strain to use and the best injection method. Then it comes to the disease variation, I think, which is really annoying to anyone who's working on any animal disease models. And it took me another several months to figure out that we can find a way to use behavior tests to narrow down the variation in this model. Then after submitting the manuscript, there comes all the long waiting time and all the reviewers' comments. And believe in me, one of your best days can be easily ruined by reading some of the reviewers' negative comments. However, it is exactly from all those setbacks and challenges that new knowledge can be gained and new technique can be established. We struggle with the model, and that is how we built a local stroke that is way more severe than anyone else can do. For the behavior tests, Gong and I and other members in the stroke group have spent a long time in our group meetings to discuss how to optimize this very small piece of the device so we can better detect the recovery of the mouse after treatment. And this is what we built after that. And it was through our conversations with nearly 9 journals and 20 reviewers that we can complete our manuscript. And we have to admit that the final version of the manuscript is much better than our initial one. So the setbacks are just part of the research, and you just have to embrace it and learn from it. And this embracing and learning process is not easy at all, but it teaches me how to always try to gain something from it and makes me appreciate more what I have gained throughout the process. And thankfully, I was never alone on this journey. There were so many people who generously offered me help and guidance, and without them, it is impossible that this work can be done and published. So first of all, I'd like to thank Dr. Chen, my PI. So there are 3 most important things I have learned from Gong. Firstly, Gong has shown me what scientific thinking is, which should include both adventurous ideas as well as critical thinking. And secondly, Gong always tells us to keep our eye on bigger pictures and higher goals. As a researcher, there are always so many interesting things that the Mother Nature showed us that can easily catch our attention and distract us from our initial goals. Gong encouraged us to pursue after something really interesting but unexpected that we observed, while he also keeps reminding us to keep thinking about the most important question of our project. And he'll make sure that we always come back to our main track. And thirdly, most importantly, I'm always inspired by his optimistic attitude, no matter what happens. This attitude he passed to the whole lab has encouraged me to keep seeking solutions to problems instead of doing nothing and complaining. So all these mindsets I learned from Gong are really treasurable merits to both research and life itself. So secondly, I want to really thank Mr. Steve Smith and family. Because of your generosity and the Steve Smith funding, my project and many others in our lab could continue without worrying where to apply funding to keep the lab going. And also thanks to Mr. Smith's donation, we can have this beautiful Arboretum which we can enjoy today. I would also like to thank my peer mentors. Working with them teach me how to take the responsibilities and be a group leader. So Dr. Ziyuan Guo and Dr. Lei Zhang were my first mentors in the lab who taught me all the lab techniques. And they were patient enough for me, because every once in a while I could screw up their experiments when I just started. And I was fortunate to participate in Ziyuan's NeuroD1 conversion project, which definitely lays the foundation for the whole stroke project. And Dr. Zheng Wu, who is sitting right there, contributed to the electrophysiology part of this paper. And he's also a great mentor to me and more like a big brother who always takes care of me no matter when it comes to experiments or on our trip to fishing or on the basketball court. And by the way, we hope to beat their team whose name is age 35 plus more often in the future. And Dr. Zifei Pei, who's sitting right there, our excellent virologist. He makes all those hundreds of amazing AAV virus that works even better than the ones we purchased from the companies. And Yu Ting, who's there too, and our lab mom, she always takes care of everything in the lab, including over 1,800 lab animals, as well as us, a group of graduate students and postdocs whose biological parents are not around. They also have contributed a lot to this stroke work and many other work in the lab, and more importantly, they treat me as a family instead of just a lab mate. And every experiment performed in this paper is a teamwork. I was lucky enough to have a team who has been working tremendously well to get the job done. The members who participated in this work included Lin Xinma and Jiu Chaoying, who were graduate students back then, but 2 doctors now. Also, we have a group of excellent undergrad students. They were Susan Keefe, Miranda Chen, Grace Lee, Emma Yelling, and Catherine Lee. The people who also contribute to this work include Mrs. Yi Hu, and Dr. Greg Kirk's group in University of Puerto Rico performed the cognitive behavior part of the work. Just like Henry Ford once said, coming together is the beginning, staying together is the progress, and working together is the success. I'm so proud of the team we have put up together and the way we work closely towards the same goal. We become friends and comrades, not just co-workers, and most of them are no longer in Penn State anymore, but I wish all the best to them, to their future. And we have a brand new stroke group now with strong additions. And what I want to say to our current member is that let's keep our good tradition, support each other, and work as a team. I would also like to say thank you to every current lab members. So in the lab, people are constantly enjoying and leaving, and there are new faces in the lab every year. But I'm so glad that everyone can contribute and keep our lab such a friendly and hardworking and family-like environment. Last but not least, My family and friends give me great support. My grandma is 2 years away from 100 years old, yet she has been living with Alzheimer's disease for many years. My grandfather passed away with Parkinson's disease, and one of my uncles has bipolar disorder for many years. They are my strongest motivation to work on neurodegenerative diseases, and I know how patients and their families suffer from these diseases. My parents and the whole big family always support me unconditionally, even though I'm very, very far away from them. And people say that life is much better if you can spend with your best friend. And that is why I married my best friend and my wife, Yu-Chen Chen. Unfortunately, she's currently on the other side of the planet and cannot join us today. Even though we can only reunion every 2 months, she always has a way to fill my life with courage and smile. So I have been saying enough about the past journey. We have finished. However, we are still far from our goal, which is to eventually push our technique from lab bench to patient bedside, and to offer a treatment to people in desperate need. So I have been receiving emails from patients all over the world asking whether they could participate in clinical trials of our technique. I hate to tell them that our work is still mostly on lab animals, and tell them that I'm afraid we're still years away from clinical trials. One of the emails I'm mostly touched came from a lady in Europe who is a survivor from a terrible car accident 8 years ago, and her brain has been severely injured, leaving her unconscious for a really long time. And then after she woke up, her whole left body has been paralyzed and she lost the ability to speak. But she didn't give up. She learned to speak again and managed to walk with assistance. Yet she's still looking for therapy that can help her to recover faster and someday maybe become a dancer again. Yet after I regretfully replied her email that we're still at early stage, but we're really working really hard to push our work to clinical trial, she replied that your work brings hope to so many, and you are very much needed and prayed for. So to me, that simple sentence is more motivating than publishing in top-ranking journal. Among the research journey, we found the more we study cell conversion technique, the more we still don't understand about it yet, and which makes us excited to discover more about it. I believe the paper is just a small yet steady step towards the treatment, and we are still far from that goal, but I think eventually, there is a very, very good chance that we will get there eventually. For stroke, for traumatic brain injury, for Huntington's disease, for spinal cord injury, and for Alzheimer's disease. Thank you.